Hey, welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson, and as always, on behalf of myself and our producer, Anita Alexander, I want to thank you very much for taking out time from your busy day. And hopefully, we'll give you some information that will improve your quality of life. Now, before we get started, you know I'm going to get on my soapbox about healthcare or about health insurance. Since the last time we've been together, I hope you've gotten insured if you're not insured. So get your health insurance. If you don't do it for you, do it for the people that you love. Do it for your wife. Do it for your husband. Do it for your children. But, in all honesty, do it for yourself. Okay? Now, you're in for a treat because I'm going to stop right here because we have an awesome guest today, Dr. Keith Melvin, and we want to have a good time to talk about him. You've probably been to some of his events or one of his events that happen each year, especially if you're a cancer survivor or you are a family member or someone you know, someone you love, someone you work with, your neighbor, your teacher, your student, somebody, possibly so. You probably met Dr. Melvin. Now, just to give you a little bit of information about him before we start, Dr. Melvin is with Mercy Health, and he's in internal medicine. So if you go to Mercy Health, you may have an appointment with him. You may look at his face when he comes up and go, I know him. He's also a graduate or alum of Withrow High School, and I think that's the Tigers. Yeah, it's the Tigers, right? Okay, so the Tigers. He also went to Fisk University and UC College of Medicine. So, Dr. Melvin, thank you very much for being on the show.
Thank you for having me.
I've known about you. I've seen you. I've been to Allen Temple a few times. So I've seen you. I've been to the celebration down at Duke Center. So it's awesome to have you sitting here with us today to talk about what you're doing in this community.
Thank you so much. And yes, I am a Withrow Tiger and went to the University of Cincinnati College of Medicine. I did my residency at Jewish Hospital here in Cincinnati. That's the oldest Jewish hospital in the country, and just from a historical perspective, I was the second African-American male to train at Jewish Hospital in medicine. The first person trained there in 1955 in residency, that was Dr. George Hale. And then I came in 1980, so I was the second guy to train in internal medicine at Jewish Hospital, the oldest Jewish hospital in the United States.
So 2 African Americans in a 30-year period.
Yes. Actually, 2 guys.
2 guys.
There were 2 women in between us.
Okay. But still,
the numbers are
4
minimal.
In a 30-year period.
Yes.
That
in
says
this
a lot.
city.
Right.
In this city.
So you've been with Mercy Health how long?
This is like my 10th year with Mercy.
Okay. And internal medicine. So just kind of brief, because
What is internal medicine?
What is internal medicine?
Internal medicine is, my training is with all adults. So an internist sees patients from 18 until they die. So we're a primary care physician. And my best reference is you take your children to a pediatrician and the parents should go see the internist. That's the best description of that. Now there's also family medicine, which encompasses pediatrics and adult medicine. And so if you go to a person that's in family medicine trained, then they see the whole family. Also, family medicine physicians sometimes do a little bit of surgery, and in the rural areas, they also deliver babies. But the internal medicine doctor is usually in the larger cities, and we take care of adults from 18 till they die. Now, your cardiologist is an internist, but then did a subspecialty in cardiology. The gastroenterologist, who does the colonoscopies and so on, is also an internist who did 2 years additional in the subspecialty of gastroenterology, so they can then do colonoscopies and so on. So those are the kinds of things that we've done. As a general internist, so I'm not a general practitioner, I'm a general internist. So my training was in internal medicine for 3 years after medical school.
That's interesting. I don't think I've ever known that much in terms of, I have a primary care.
Yes.
And Joe Hackworth is actually my cardiologist.
Joe Hackworth is, just for your own knowledge, Joe Hackworth was in the first class at the University of Alabama that a black student got to go to the medical school there. Joe Hackworth's in that first class. And he's from Alabama, so he understood the culture, and that probably helped him to navigate through that. And then he came to Cincinnati to do his cardiology fellowship, and then, thank God, he stayed here in Cincinnati because Joe Hackworth is an awesome cardiologist.
You took the word. I was getting ready to say, thank God he stayed, because when I encountered him and I was referred to him, there was some. I just had a heart attack.
Yes.
But there was still some complications, and the cardiologist I was dealing with, no names, told me, well, we're just going to have to let that work itself out. There's nothing we can do. And I went and saw Joe, and Joe was like, no, this Thursday I'm going to bring you in, and we're going to do some stuff.
We'll figure it out.
And since then, if I'm going anytime, I'm going to go see him.
No
At the
doubt.
end of the day, I thought and still think he is a phenomenal doctor. And I don't know how many people I've sent to him. When I encounter people with heart issues, it's like, you need to go see Joe. Well, I'm seeing so-and-so. Well, I don't know so-and-so, but I know Joe.
Yes.
So going with that. But thanks very much for giving that information, because a lot of times we don't have correct information. And especially, unfortunately, in our community, sometimes we're not getting the appropriate information. We don't understand, or we're going with what maybe mama thought, as opposed to getting more. There's a scripture somewhere in the Bible that says, my people perish for lack of knowledge or lack of information. So I thank you very much for that. I want to make sure, we want to jump to this. You are the co-founder, along with Bill Mabry,
Yes.
of the Black and White Cancer Survivors Foundation celebration. I'm going to put this up so that you can see it, because it's coming up here next week?
Next weekend, in
Next
fact.
weekend.
And so that story goes, Bill Mabry is a patient of mine. His wife's a breast cancer survivor for like 10 years. My wife is actually a 2-time cancer survivor. And so Bill Mabry as my patient, and he as a DJ came to me 10 years ago and said, Doc, we ought to have a party and celebrate our wives having survived cancer. Well, okay, we'll have a party. We had a party out at the Atrium in Tri-County. 120 people came. Ollie's Trolley was the caterer. We had music and so forth. 120 people actually showed up. I was like, wow, people actually came out for this celebration. So we did it again, had 160 people at the Atrium. And then we did 3 years at the Atrium, but we outgrew the Atrium. So we moved on to the Sharonville Convention Center. We were there for 3 or 4 years, and we outgrew that at 800. And then we moved to the Duke Energy Center. And this will be our 3rd year to Duke Energy Center, Pastor Jackson. And we will have 1,500 people in attendance. So the Lord has truly blessed this idea and this mission that we've had. And actually the mission of the foundation, once we became a foundation, was to increase awareness and to promote screening so that early detection will be the rule in people who are diagnosed with cancer. And then we've also used our resources and funds to provide monies to those folks who help you navigate through the challenge of cancer. So we've helped out the American Cancer Society, we've helped out the Cancer Support Community. Those are the larger institutions. And then we've helped the I Will Foundation that recognizes younger folks with the brain cancer that the kids are dying from. We help Mommy Has Breast Cancer, which is an organization of women who have helped one another. They've gone over and done some babysitting. They've helped take you to your appointments and so forth. They've cleaned and cooked in your house and that kind of thing. And we also helped the Erica J. Holloman Foundation. That is about the triple-negative breast cancer that affects young women, but particularly has an affinity for young African-American women. So we helped those organizations. Last year, we added in Blue Against Cancer, which is the police officers organization that is helping police officers that have been diagnosed with cancer. So this is what we've done with this. And as I said, the Lord has blessed us to have a very successful event. But the mission is right and the cause is just. And with very little advertisement other than word of mouth, we've grown from 120 people to 1,500 people. And this year, we even have a second day on Friday, November the 2nd. We're having a concert at the Duke Energy Center with Confunction nationally known, and they are being opened by
Can function.
yes. Well, they're going to be opened by Second Wind, which is our own local band.
Absolutely.
And then we have an after party at the Duke Energy Center. Julia's and maybe even Scott's is providing some food for you to purchase while you're there. So it's going to be a great weekend, and I'm really looking forward to it. Friday night with the concert, and the Saturday night we finish up with the awesome gala. It has great entertainment. It has great fellowship. Everyone's dressed in black ties, so they're looking good, dressed to the nines, as they say. And they have a great time. And I'll be honest, everyone's gone by midnight. I've gotten older now. I don't do all that 1 or 2 o'clock in the morning stuff. By midnight, I'm heading to my bed.
You're not heading out the door. You are heading to bed by midnight.
I'm trying to cut to the chase, you know.
I understand. You know, I was at the one, not last year, but year before last, when Tracy Robinson ministered with Flags. And then I know Sierra Harper sung last year, and she will be back this year. But you know, it's funny, until you actually do a little bit more digging or get more information, I know about the event, the celebration, I've been there, but everything you just talked about, all the work, the good work that this foundation is doing, I had no idea. And now I feel bad that I didn't know about it, but then I feel good that you've given us some information to understand that this isn't just, even though it's a fabulous night. You know, I've got my tux ready. I'm ready to go. It's already been to the cleaners. It's good to go. You know, but it's not just a night to come out just so that you have something to do on a Friday or Saturday night. It's also working for a good cause. And I think probably most, maybe not all, but most of us in some way or another has been touched by cancer, whether it's someone we love, whether it's ourselves. Personally, I was sharing with you before we started that I had 2 scares over the summer, one in August with a growth that's been in my head forever, but a doctor looked at and was alarmed and said, I'm afraid this is cancer. And then a growth on my arm. To God be the glory, it was, is it benign? It was benign. But what that did for me was it heightened more my awareness, because sometimes in things we know about it, we hear about them, but you know, if it doesn't sometimes touch us personally, we kind of deal with it, and maybe not necessarily in passing, but when it's touching you personally, you actually get a little bit more involved and a little bit more concerned. So now, even though it was benign, I look at this celebration and this foundation in a totally different light, and understanding, you know, my other mother, I had a foster mom. My foster mom died of cancer, and back in that time, this was like 74, so I was about 14. You know, back then you didn't tell your kids everything, so I had no idea. I didn't know what cancer was, but she passed. So, but this is giving me more. It's opening my eyes, and this celebration, this next weekend, is very important for people to come out. Whether you are a survivor yourself of cancer, whether you have someone in your family who's suffering with it now, or maybe, unfortunately, we've lost them. But either way, it's a night to come out, to be around people who understand, who either have been where you are, they're where you are, but they understand. So it's a night to come out in it. Well, no, now it's 2 nights to come out and enjoy yourself for a cause that is important in our community. And then you've got Confunction. You know, I mean, I'm only 22, so I'm not sure. I've heard about Confunction, but we know Confunction is live, and Second Wind is a phenomenal group. So you've got 2 nights that's going to be great. I want to put this up one more time. I want to make sure people get it. And tell us if people want to get more information.
Well, and certainly tickets are available in my office at 585-9500. That's at Mercy Health, Avondale. So you can call 585-9500. You can call Bill Mabry at 742-4388. You can also go online, Black and White Cancer Survivor Foundation.com. But I'd say, and then of course my team members all have tickets, but at this point I would say I'd probably call my office.
Call your office.
Because soon the online sales will stop just because of time. But yes, Pastor Jackson, it's been a great run for me personally, because I also was diagnosed with prostate cancer when I was 47 years old. My wife's a survivor 2 times with cancer. And as I said, my co-founder, Bill Mabry's wife, Deborah, is a breast cancer survivor. And so we had a personal affinity for the idea and the concept of doing something. But what we've done as it has evolved is clearly, my objective has always been to increase awareness because, you know, in men's health, black men weren't getting PSAs, they weren't getting digital rectal exams, and so of course everyone has understood now that prostate cancer affects African American men twice as often as anybody else. And of course we know breast cancer is hitting 1 out of 6 or 8 women, and it's all over the place, and sometimes it hits men. So what we've done at this event is, yes, we have a party, and that's a foundation for you to come out dressed to the nines, looking good in the early, late, mid-fall. But more importantly, it's because when you get there, not only are you entertained and not only do you have the fellowshipping, but we historically at our events have been very educational. We have people doing testimonies. We have folks telling what they do at their organizations. My sponsors, not only is Mercy Health a sponsor, UC Health is a sponsor, Oncology Hematology Care, the Urology Group, who takes care of almost all the men with prostate cancer in this city, and several others, Western Southern, you know. So there are many sponsors that we have here that are helping us to continue not only to disseminate this information, but just providing support so that we can help these other organizations. And yes, we do give money to the large, well-known organizations, such as the American Cancer Society, for which monies that we give is usually earmarked for Relay for Life of the Soul, which is a once-a-year annual affair that occurs usually in our community that's specifically targeting African Americans. So we earmark our dollars to the American Cancer Society for that event. Cancer Support Community, which is all over the United States, but one here is in Blue Ash, and I've been out there, I'm on the board. They have a great concept of helping people. If you go out there and there's hardly anyone of color there. So we have not been aware of the fact that there's an organization that's here willing, ready, able, full of resources to help people out. And so my objective and my job as a physician and as the founder has been to make sure people in our community understand that these resources are available. And why do you need them? Because you cannot navigate through the challenge of a diagnosis of prostate cancer, breast cancer, colon cancer, lung cancer, or any cancer by yourself. You'll need some help. I don't care who you are. It's a scary time. It's a tough time. It's very, very challenging. And everybody doesn't even make it through. But the key to our plans and our program has been early detection is a rule. And so we have promoted screenings, lung screening, colon screenings, breast screenings, and the other thing, you mentioned it, if a guy or a lady comes in for their screenings, they will then probably get blood pressure checked, sugar checked, cholesterol, and so forth. So what you'll do is then dial in to your own health care. And I say to folks all the time, particularly women, listen to your body. If something doesn't quite seem right, it probably isn't. So go to the doctor and find out. And if the doctor doesn't pay attention to you, get another doctor.
Get another doctor.
But you should, for yourself, should be knowledgeable enough and educated enough to understand when you should be screened for prostate cancer, when you should get a mammogram, when you should get a colonoscopy, and when and who should get lung screenings and so on. You should be knowledgeable enough about those things. And these are the kind of teachings that we've done through the foundation at our annual gala. So you're not only there to have a good time, and dinner is good, and we have great entertainment, but we're there to educate folks. And even our souvenir journal is worth keeping because it has lists and numbers of doctors' phone numbers. It has those resources such as the Erica J. Holloman Foundation that has provided bras for hundreds and thousands of women. Mommy, as I said, Mommy has breast cancer. They come over and take care of people, cook food for the woman who's going through the breast cancer treatment scheme, take them to the doctor appointments, all kinds of things. These are the kind of resources that are available, but you have to know that they're available for you to access those.
And that's that my people perish
Yes.
for lack of information.
Lack
You
of
know,
knowledge.
My ex-wife Robin, and this is my youngest son's Chase mom, back October 1st actually of 17. This October 1st was a year since her death. I know that usually when people hear cancer, you hear, or a lot of people think, okay, so that's a death sentence. I don't have long. You know, the interesting thing about for Robin, she had cancer. Then I guess they got it under control. They got it, and then it came back again. And actually, the thing is, the doctors, like I said, she died a year ago now. But before that, about 3 years before that, the doctors told her, you have 1 year.
Yes.
And she lived 3 more years because
Yes.
one of the biggest things was she just wanted to make sure she saw our son graduate.
Yes.
Not only did she get to see him graduate, she saw him go through into college,
Yes,
into a
yes.
year of college. So, you know, God is awesome. At the end of the day, God has the final saying. And also on a personal note, my primary care has been trying to get me to do the
Colonoscopy.
colonoscopy, and Dr. Vickers and
Oh, yeah.
and
I
he's
know
very
Dr.
persistent
Vickers.
on it.
Well, he's
And-
correct.
And he's correct. But so what has happened here? You kind of talked me into it without talking me into it. So when I leave, well, not today because it'll be too late, but tomorrow morning will be my first call to him, for him to get me into setting up. Not thrilled about it, but you're right. You know, that's some of the things with us, and especially black men. A lot of times we won't go to the doctor. We won't go get what needs to be taken care of, and then it's too late,
Well,
or not too late. But
Usually
then
we're scared to go.
and I will admit, I'm nervous about it.
We don't want to have any blood drawn. We don't want any needle sticks. We don't want any shots. And we've been able to get away with it because only our wives, mothers, and daughters have had to go have pap smears. We've been able to get away once we hit 18, 21 years old without going to do anything. So we've been hiding behind that machismo piece when we really are scared to go. The truth is, what I tell guys all the time, it's okay to be scared, but you still got to do it.
You got to do it.
I've had 3 colonoscopies, and it's time for my 4th one, and my Dr. Attar is looking for me. He's called me, and I'm going. I just got to get my time a little bit better for me to go. But it's important for you to go because we as a community must change our perspective to a proactive perspective and not the reactive perspective that we have had with everything. And I say it because I say we're always protesting when you already know they didn't want you to be there, they don't like you to come there, and they don't want you to be around. So we react and protest. The fact is, we should have been proactive in the first place with everything we do. And I try to teach my own kids, act, don't react. Because if you react, you'll have to take it back, fix it if you can, and so forth. But you can't unwind the clock, and you can't take the words back. So let's just act. Hold your tongue for a second and act. The fact is, we're teaching you now. You do need to have your blood drawn. You do need a PSA. You do need lung screening if you've been smoking. You do need a colonoscopy once you hit 40 or 45, and clearly at 50, but 40 and 45 for African Americans. And a woman should have a mammogram easily at the age of 40. And if she's had breast cancer in her family, I'd get one at 30 or 35. And she should do self-breast exams when she becomes a grown woman. She should already start. I've had 2 24-year-old women with breast cancer, but let me tell you this too, Pastor Jackson, I've also had 2 31-year-old men with prostate cancer, both of whom's fathers had prostate cancer, but that stuff in your family, what we have not learned and what we have not known historically, you alluded to it earlier, we haven't known what our families died from because it was always a secret. Nobody would ever talk about it. They said she had old age and all kinds of different things. They make up stuff. But now, as baby boomers, we are the first generation that actually has some knowledge. And it is our responsibility to pass that knowledge down to our children, our nephews and nieces, so they'll understand what kind of diseases are in our family. Because, you know, if you look like your mama or you look like your daddy, you're probably going to have a body on the inside that looks like them also. It's just the way it is. And you know, you talk about in our community, hypertension, diabetes, and high cholesterol. Those are I call it black man's diseases. It's high sugar, high fat, and high salt. Those are just things that's just the way it is in our community. I don't like it either. But instead of me being mad about it and upset about it, let's learn to be proactive. Don't shake the salt when it's on your plate. don't eat so much fried and fatty foods, and if you no diabetes in your family, cut out some of the carbohydrates. You know, it's not that hard. Just cut back. Modify what you're doing, but take it seriously, because those diseases will take you very seriously. And if you wait till they've all gotten a hold of you, I always tell guys all the time, don't wait till the horses are gone and then come running over here to me, because I ain't no gatekeeper once you get to that point. If the horses are gone, they're gone. And all I can do is close the barn door behind it. But everything's over with.
Okay.
You're already in trouble. But I've been over there
real.
for 35 years. So, as they say, holla at your boy. You know what I mean?
I like that. I like that. We only have a couple of minutes left. And I want to make sure that we mention again, it is the Black and White Cancer Survivors Foundation celebration.
Yes.
Friday night, which is November 2nd, you're going to have Confunction. And look, celebrating 45 years of funk.
Yes.
So Confunction has been around. And Second Wind, local, you probably seen them maybe somewhere. Listen, a phenomenal group. Sharing the stage with Confunction, it makes sense because they're just that good. And then the actual, the gala or the actual big event, which is, well, they're both big events, but I mean the main event, let me put it that way, Saturday, November 3rd. And both times they're starting at, I'm looking
The show starts Friday night at 7, doors open at 6, and on Saturday night, the gala dinner is at 7, but the reception starts at 5:30. And we have free valet parking until it's all filled up on Saturday night, and you can still get tickets for the concert on Friday, and you can get tickets at the door.
At the door.
But at the gala, you cannot get tickets at the door.
So make sure, listen, if you want to come out, make sure that you reach out to Dr. Melvin's office.
Yes.
Get your tickets. Look, don't show up without a ticket and then going, I wanted to get in. What happened? Well, he's giving you the information. But you want to come out. And free valet parking, as long as, so in other words, you know, use that other time. Don't use that other time and get there and then wonder why you can't get free parking.
And they stop serving dinner after 8:30.
After 8:30.
And also, we have some of Cincinnati's finest firefighters will be there with wheelchairs to escort folks from the door all the way up to their seats. So some of the African-American firefighters have worked with us for the past couple of years, and Mulaney's loans the wheelchairs to us that night of the gala for that use. So we've really worked with a lot of the institutions and resources here in our community. We've worked collaboratively with all of those people and all of the folks in our community. So this is a community event. It's very diverse. There's all kinds of folks there, all ages, all races and creeds and colors and ethnicities or whatever.
So you
all
got
kinds of folks
all
are there.
for
We have
everyone.
the right event. And it's because cancer doesn't care who you are, where you live, what kind of job you got, or how much money's in the bank. It has an effect on all of us. And what we are still doing too, Pastor Jackson, everyone that is there learns from the education that we provide. So what we are doing is still creating ambassadors to go back to their family, their friends, their co-workers, and their community with more information, armed to tell them how important screening is, so that early detection can be the rule for all of those folks that they have an effect on.
Dr. Melvin, I want to thank you again for coming out and spending time. I know you're busy. You're a week away, so I know you're busy. Thank you very much. And listen, we want to thank you for, again, spending time with us. I want to say again, on behalf of myself and our producer, Anita Alexander, we thank you. I know you got some information today that will be life-changing. So until the next time we're together, get enrolled in healthcare, go get the colonoscopy, take care of yourself, stay faithful, stay healthy.